What are the early signs of hemophilia A in children? Imagine your child playing and suddenly bleeding longer than usual from a small scrape. Sometimes, it's not just a minor bump but a sign of something more serious. Hemophilia A is a genetic condition that affects how blood clots. It happens when a child has a deficiency in clotting factor 8, a protein needed to stop bleeding. Most often, it runs in families and is more common in boys. Early signs can show up during infancy or early childhood, especially as kids become more active and start exploring. You might notice that your child bleeds excessively after minor injuries like scrapes or bruises. The bleeding might last much longer than expected or restart even after it seems to stop. Large, unexplained bruises are another common sign. These bruises can appear without a clear cause and may be deeper or more painful than usual. Swelling or stiffness in joints such as the knees, elbows, or ankles can also be a clue. This often results from bleeding into the joint space, which can cause a tingling feeling before swelling and pain develop. Bleeding from the gums, especially after losing a baby tooth or during routine dental care, is another sign to watch for. Frequent nosebleeds that are hard to stop can also indicate a bleeding disorder. If your child undergoes routine procedures like vaccinations or blood tests, prolonged bleeding afterward might be a sign of hemophilia A. Blood in the urine or stool can suggest internal bleeding in the bladder, kidneys, or digestive system. In infants, signs might include unexplained fussiness, irritability, or refusal to crawl or walk, especially if there is bleeding in muscles or joints. The severity of symptoms depends on how much clotting factor 8 is present. Children with mild hemophilia may not show symptoms unless they have surgery or a significant injury. Those with more severe forms can have spontaneous bleeding episodes even without injury. If there is a family history of bleeding problems or unexplained bleeding, genetic testing can help identify the risk early. Detecting hemophilia early allows for better management and can prevent serious complications like joint damage or life-threatening bleeding. If you notice any of these signs in your child, especially with a family history, it's important to consult a healthcare provider who specializes in hereditary health and genetic conditions. They can guide you through testing and help you plan the best care for your child.